Before you give these medications, stop. There are a few things you should always check first because missing just one of these could seriously harm your patients. Today, I am going to teach you 10 medications every nursing student and every nurse should know when to hold. Let's get started. Number 1 is Digoxin. Digoxin, before giving Digoxin, we need to always check the apical pulse. If the apical pulse is less than 60 beats per minute in an adult, please hold the medication and notify the provider because Digoxin can cause bradycardia. Number 2 is Metoprolol. Check the heart rate and the blood pressure. If the heart rate is less than 60 beats per minute, or the systolic blood pressure is less than 90 millimeters of mercury, you need to hold the medication because beta blockers can lower the heart rate and also lower the blood pressure. Number 3 is Furosemide. Furosemide is also called or known as Lasix, and Furosemide is a loop diuretic, so you always want to check the potassium level. Normal potassium is 3.5 to 5.0, so hold this medication if potassium is less than 3.5 because furosemide causes potassium loss and this can cause dangerous cardiac arrhythmias. Number 4 is Lisinopril. Lisinopril is an ACE inhibitor and can cause potassium retention. Now, if the potassium is greater than 5, hold this medication because it can worsen hyperkalemia. Second thing to check with Lisinopril is the blood pressure. Since ACE inhibitors can cause hypertension, we need to check the blood pressure. The 5th medication is morphine. Before giving morphine, always assess the respiratory rate because if the respiratory rate is less than 12 beats per minute, hold the medication because morphine can cause respiratory depression. Number 6 is nitroglycerin. Always check the blood pressure first before you administer nitroglycerin. If the systolic blood pressure is less than 90 millimeters of mercury, you need to hold the medication because nitroglycerin causes vasodilation and this can potentially lower the blood pressure even more. Number 7 is Warfarin. Before giving Warfarin, monitor the patient's INR. For most patients, their therapeutic range or therapeutic INR is 2 to 3. Some patients may have mechanical heart valves and their goal might be 2.5 to 3.5. Now, if the patient's INR is above the prescribed therapeutic range or if the patient is bleeding, please hold his medication and notify the provider. Number 8 is heparin. Heparin is used to prevent blood clots. Now, you need to monitor the APTT. Normal APTT is approximately 25 to 35 seconds, but the therapeutic range is usually about 1.5 to 2.5 times the normal value. If the APTT is above your facility's protocol or the patient is bleeding, please hold the medication and notify the provider. Number 9 is insulin. Always check the patient's blood glucose before administering insulin, even if you are treating hyperkalemia. Always check the blood glucose. If the blood glucose is less than 70, the insulin specifically can cause hypoglycemia. If it is less than 70, please hold and notify the provider, most especially if this patient is neopam oral. Number 10 is potassium. Before giving potassium, always check the patient's potassium level and kidney function. If the patient's potassium is already elevated or the patient has little or no urine output, and is not a dialysis patient, please hold the medication and notify the provider. Giving potassium in these situations can cause life-threatening cardiac arrhythmias. So here is your NCLEX tip. Do not just memorize the numbers. Always understand why you're holding the medication or what is an indication for the medication. When you know the reason why you're administering or holding the medication, you'll be able to answer your NCLEX questions more confidently and provide a safe care. And remember, as always, if this helped you, please like this video, follow for more, and I'll see you in the next one. Happy studying.